So now we're going to take a look at the actual symmetry, and we want to find what is symmetrical and asymmetrical by looking at the bony landmarks. So the first two landmarks are the anterior superior iliac spine. The other landmarks we're going to use are the superior pubic bone and the anterior pubic bone. We're also going to show you how to palpate the iliac crests, the ischial tuberosities, people call the sit bones. The last thing that we're going to show you how to palpate when we're working on our pelvic dysfunction is the ankles. I'll have my patient lie down and bend her knees up for me, and I've already determined the hypomobile side earlier, and it was her left side. I'm going to have her raise her hips up in the air, and the reason I do this, and down you go, is so that her pelvis doesn't get skewed on the table. Sometimes tables have a crack in them, and some of the big treatment tables have a real big separation. I want to get her behind up above that so that I don't have any problem with the hips being off because of the table. I come down here. I gently say, on three, let me have your feet, 1, 2, 3, and I just draw them out like that, and I don't tug on them. I just draw them out, and I'll shake them a little bit if I want, just to get some tone out of there, and then I'll look with my dominant eye, and I'm assessing which of my thumbs is closer to her head and which of my thumbs is closer to me. And as it so happens that my thumb, which is bumped up against the inferior portion of the medial malleolus, is closer to her head. It's up. So I've got a short leg on this side. I come up to the pelvis. I like to move the pants out of the way if I can, but if I can't, I pull them up as high as I can so that I've got a nice solid background to look at. Sometimes a person has a belt that's off a little bit like this. That's why I like to get the clothes out of the way. If at all possible, pull down a little bit. I come underneath the anterior superior iliac spine and I push up. And I take a look at my thumbs and say, which of these thumbs is up or down? And in this case, what I find out is this thumb on the left-hand side, which was her hypomobile side, is actually closer to her head by about 1/4 of an inch. And it only needs to be about 1/4 of an inch. This side is closer to her foot, but I'm not going to worry about this because it's not the hypomobile side. All right? People always make that mistake. So I'm looking at this. Here we go. She's got this is elevated here, so we're going to call that a posterior rotation. She's got a short leg and a posterior rotation, and my mind is already going, oh, that's in pattern. I don't have a problem with that. So after we've done the anterior superior iliac spines and I'm looking for ilial rotations, I keep my thumbs right where I had them. And what I do is I just swing my fingers up and see if my fingers are asymmetrical on a midline of her body. Now, most people, the midline of the body is the belly button. Every once in a while.